So today's surgery is going to be the brain transplant, correct? Okay, just one moment. I'm just getting caught up here. I just got here. I just got out of my 4th surgery today. So I'm gonna just need some patience from all you nurses, okay? Does anybody have any questions for me before we get started? Okay. Well, how many of these have you done? Have you done a brain transplant before? Okay, this is your first time? Okay. Well, you gotta learn sometime, you know, so it's fine. I'll walk you through everything. No need to worry or anything. This is gonna go very smoothly. I've done about 125 of these. This will be going on 126. So I've done a lot of these. So we're going to need a couple of moments just to get the information going. Okay. Everybody have their gloves, masks on? Okay. Everybody sanitized ahead of time? Okay, let me just check a couple things over here. Okay, so they are prepped and ready to go, I see. Okay. I'm gonna need a main assistant. Does anybody want to volunteer? Okay, alright, go ahead. So basically, anytime I need something or ask for something, just go ahead and get that for me. That'd be great. So this should go pretty smooth, according to my files on this patient previously. So, no other severe medical condition I'm seeing, and all their medications are compatible with what we're going to be using on them today, okay? So that's good. Let's see. And how long ago was he medicated? Anybody? Okay. Perfect. We are good on time. Okay, so we're gonna get this started right away. First off, we're gonna need to measure. Going to need to start measuring. Does anybody have just a simple measuring tape with them? Okay. I'll go ahead and take that from you. Alright. So, let's get this ready to... We're gonna need to have somebody write this down for me, or I can do that if you guys want to take control of the monitor area over there, and I will go ahead and worry about this part. Let's just get set up. Okay. So we're measuring the area, the perimeter of the skull, and just currently the area that we're going to have to surgically cut open, quite frankly. So what I'm going to do is I'm just going to go ahead and shout out some numbers, and this is more for my information or for my mental notes than yours, okay? That way I remember what to write down in just a bit. So everybody is very particular, very specific. So very precise, okay? We have to be, our precision has to be on point, okay, if you will. So, bear with me just a second. I'm a little wound up from the last surgery, but we will talk about that a little later. So, right now I'm just focusing on this. Everybody, take a breath. This is gonna go smooth. Everyone's gonna be fine. Everything's gonna be okay. Alright. 3/4 from 6.5. And let's see. 2 and 3/4 from 5 and 4. 5 and 1/4. Okay. And 1/4. Okay. All right. We're going to go up from here, and we're going to make an incision on. I want to say it's going to be 8 and 3/4, starting the incision going from 8 and 3/4 to just put that point to 16 and 1/8. Okay. And 1/8. Okay. So we are gonna go back through after we get all these measurements. We're gonna make little markings. Okay. I might have to just shave a little bit of this hair over here. There's not much to take off in this area, but we are gonna have to clean that up. Okay. Did somebody bring scissors and razor? Okay, good. Okay, so double checking that incision marking. Okay. Alright. That's perfect, okay. One second, just give me a moment. Alright. Just gotta get these little. Okay. And what's their heart rate at right now, currently? Okay. Stable. Just one moment, guys. I know we're wanting to get started on the next part, but really, just give me a moment, okay? Okay. Alright. I'm just getting our healing patches prepared. So let me take a look at, let's just take a look at the current. Has anybody seen my flashlight? Okay. Alright, I'll go ahead and take that from you. Okay. Okay, let's just take a look. Alright. Can I get a little bit more light over here? Okay, good. Thank you. Thank you so much. Okay. Alright. I think... Okay. Alright, so we're gonna go ahead and make our markings. Okay. Okay. Alright, so our incision markings. Can somebody... Actually, you know what, don't worry about it. Just keep an eye on the monitors over there, and I'll go ahead and read them myself, just so I can make sure I'm getting the correct numbers for the correct areas. Okay, so we have 2 and 3. Okay, I'm gonna make a little marking, get it right there. Okay, and incision marking 1, 2, incision marking 2, and 3, and 4. Okay. Let me double check those numbers. Make sure I did them right. Okay. Incision marking 1 is perfect. Incision marking 2. Okay, good. Incision marking 3, we have, what was that? Okay. Let me remeasure that one more time. Just wanting to be sure. Okay. And that is exactly how I thought. Yep, that's correct. Okay. And how's the heart rate? Okay. Perfect. Okay. So just getting a few things prepared, guys. Bear with me just for a second. Alright, I'm gonna need to change my gloves since I've been touching numerous tools. Just want to be extra sanitary. Can somebody please hand me one of those packets of gloves? Okay, thank you. These will do. These will do just fine. Okay. Can somebody please tell me the blood type of this patient? Okay, good. Good, good, good. Alright, so let's go ahead and get started. I'm going to first cut just a little bit around the area. Not much at all. Okay, see how I'm doing this? See how I'm doing? Okay, good. It doesn't take much time at all. It's just a really simple task here. Okay, that cuts off a little bit of that. And I'm going to just a shaving oil just so we can get a really precise shave just on this area here. Okay. Alright. Take a look at that. Great. All cleaned up and ready to go. So, going to need my incision tools. Okay, so just making an incision right on the line, okay? Just right over. Okay. Very smooth. Good, good, good. Okay. Kind of pulling back the layers really quickly. That way we can get enough room to move the bone. Okay. I'm gonna come right in here and just we're gonna kind of carve. How's the heart rate monitor going? Okay, good. Okay. Mm-hmm. Can I have just a few of those cotton swabs there? Thank you. Perfect. Okay, so I'm just gonna go in and clean up some of this. Okay, just a little bit of blood here. gonna be a whole lot more in just a little bit, okay? This is just cleaning up a little bit, alright? Alright. Okay. Actually, I'm gonna have one of you go ahead and continue cleaning that up. Okay. We are about to remove the skull, and then we will be exposing the brain, so we're going to have to do the transplant very quickly once that happens. We don't want to do the actual transmitting part slowly at all, so I need everybody to come together, okay? And who has the brain that we are replacing? Or that we're replacing this brain with? Who has that? You do. Okay, good. Good. Alright. So, is everybody ready for this? Okay. Alright. Alright, we're gonna go in. We're gonna lift up the bone and okay. Alright, and there's the brain. Alright, and everybody, you see how it has this gray color. Okay. That today is why we are transplanting. Okay. So we are going to examine this just for a second. Before we take it out, we want to make sure we have a match. Everything is how we pictured it would be. Okay. Good. Alright. So I'm going to go ahead and take the brain out. Alright. And go ahead and give me the new brain. Thank you. Okay. Go ahead and put this in. Right there. Good. Okay. That worked out really good. Okay. I'll help you guys out just a second. I'm gonna wipe. There's a lot of blood here. I'm just gonna wipe that down. It's okay. That's completely fine. It's normal to lose a little bit like this. Okay. Right. Perfect. Okay, you guys have the skull back intact. Okay, so we're gonna go ahead and peel. I'm gonna place the skin back on. Okay, so I'm gonna take out those pins that we had. Kind of pinning it. Okay. Alright. And we're gonna do a little bit of this, this. Stitch this up. Can I get some help with the stitching? Okay. Good. Okay. All right. Okay. I'm gonna go ahead and have you guys do a little bit of the cleanup, okay, while I make a few of the notes here. And how's the heart rate? Stable. Okay, great. Okay. We're gonna go ahead and do that brain scan that we had prepared. Okay. Good. I'm just gonna clean up a couple things. Does anybody have any questions for me? Okay, great. Just gonna look at really quickly and see how we're doing. Those stitches, beautiful, beautiful stitching. Okay. I'm really happy with that, how that turned out there. Okay. I'm just gonna look at a little bit of look here. Okay. Alright. And that looks really good. Just gonna wipe away a couple things right here. I need a couple of you to continue on with the cleanup work. You guys did a really great job though. This is just gonna need a little bit more attention down here. Okay, see? Yep, you see this? See all that right there? Yeah, we're gonna want all that cleaned up. Just so they don't have any, stainage when they wake up or anything. Okay. So go ahead and continue on that. We're going to just give it a few more minutes and then we're going to go ahead and do the brain scan, see how it's doing, see how it's fitting in. Okay. All right. Can someone just shout out the date of birth on this patient just so I can verify in my computer? Okay, thank you. Go ahead and ask for another pair of gloves, please. We're all out of the blue, that's fine. Yep, those will work just fine. Okay. I'm just gonna go ahead and put a bandage on. Everybody got that all cleaned up, right? Okay, perfect. Okay. So just gently putting that on there. Okay. This went as smooth as I could have hoped for. I'm just gonna put a little bit of tape on the bandage just to double make sure that it stays. Okay. All right. One of you go ahead and position him for the brain scan. And I'm going to ask one of you to go ahead and take that for me. And I have it set up to where it's going to show up on my computer, so I will be able to see the results. I will report back to you guys as soon as I find out how we're doing. Just give me a minute. Okay, go ahead. All right. Go ahead and do the same scan. One more picture for me, please. One more scan for me. Okay. And do you have him completely aligned correctly? Okay. Alright, and go ahead and turn him to the left and take the scan. Okay. Whenever you're ready, go ahead. Okay, it's matching up perfectly. We did a great job, guys. We do need to go ahead and check the right side, so go ahead and turn him and do that. Okay, yep, go ahead. Okay, that matched up perfectly as well. Just gonna quickly go ahead and do a little check here. Make sure they're doing okay. Looks like they're doing fine. Okay. Is everyone doing okay? Anyone have any questions for me? Anything? Okay. Alright. Okay, and can someone read out for me the heart rate again, please? Okay, it's getting a little low. So we're gonna want to keep an eye on that. fast for a little bit and make sure it gets back to the normal rate, okay? Okay. All right. That all checked out really good. Okay. How's the heart rate now? It's going back up a little bit. Okay, good. That's what I like to hear. I'm gonna go ahead and check his fluids as well. How are they looking? Looking good? Alright, good. Alright, I'm gonna have, okay, let's see, I'm sorry, just 1 second. I'm just gonna check the samples that you guys gathered earlier. Okay, so just give me a second. Okay. Which one of you took these samples? You did? Okay, you did an excellent job. I just wanted to give credit where credit is due, of course. So, okay. And okay. All right. I just get a little bit of blood on my hand just from the sample. Does anybody have a wipe? Okay, thank you. Just needed to get that off, okay. And let's see, I'm going to give you 2 more tubes. I just want you to get another blood sample for me, okay? And go ahead and take up to the lab downstairs for me, if you could do that. Okay, thank you. Okay. Does somebody know the time right now? I forgot my watch at home. Okay, thank you. Alright, and I'm gonna need my pair of gloves back. Let's see. Stick them over here. Okay. So we're gonna take some samples on the brain that we removed, okay? Okay. Alright. Go ahead and let me see that brain, okay? Alright, and you can go ahead and roll him over there. Okay. Alright, I'm just going to place this on my sight viewing table here, and let's see. Go ahead and alright. I'm just gonna inspect this a little bit. Really see what Ooh. Ooh, okay. Yes, you, nurse. Go ahead and come over here. I want to show you something. I'll show you what I see. Just try it in the middle there. Hold on. Okay, you see that? Right there. Okay. That's what was causing the rest of the brain to initially rot. So, okay. We're gonna take a look at that, and we're gonna definitely take a sample of that. We're gonna actually see if we can get this to open up. Can I have my tongs? Thank you. Okay, so we're just gonna go right in the middle here. We almost got it. Okay, just. Oh my, okay. 1 second. A couple more tools here. Okay, everybody, I want you to look really closely. Okay, we almost got this. So it looks like we're gonna need some samples of that as well. Looks like a bone, almost mimicking teeth were growing on both sides here. You see that? Okay, we're gonna want some samples of all of this, and we're gonna want those sent to the lab immediately. Okay. And I want you to check on their other organs as well, please. Okay. Just do just a simple look. Okay. I just need to make a couple notes about what we just seen. Like I said, this is the 126th brain surgery, transfusion that I did. And I've never seen that before. Okay, so I'm just gonna need to make up some notes here. You learn something new every day. You see something new every day when you work in this field. You know, it's kind of inevitable at this point. Okay. So I need everybody to just keep it together. Okay. Keep it together, everybody. All right. They're gonna feel a lot better though. That's the good thing. That's the fortunate news. They're gonna feel a whole lot better when they wake up. Let's see. I'm looking in their medical history right now. And it says that they had an appointment to do this 6 months ago. But it got rescheduled. Okay, so the brain actually had a little bit while longer to develop into this kind of rare stage that we usually wouldn't see. I guess the medication that they were on kind of kept them stabilized. That's what my guess is. Okay. Alright, so I am going to suggest they spend the next 24 hours just resting, sleeping. After that, we will lower their dosage of medication, see how they do. If they're doing fine, we can go ahead and start working on treatment and, waking them up. Okay, seeing how they do with that. So Is everybody good with that? Everybody fine with that? Okay. Okay. And how's that heart rate looking? Stabilized. Okay, good. These are all great signs that they're gonna do well. And again, like I said at the beginning, you know, this patient's never had any problems or anything like that, so they should be fine. Yeah, absolutely. Well, if nobody has any questions for me, I guess I'm all done here. I better move on to my next surgery. Okay. Thank you all. You guys did a really great job today. Okay. All right. I'll see you next time. All right. Bye-bye.